ceremony. Thank you.
Hi everybody, my name's Annie O'Callahan from the Market Intelligence Desk. We're so excited to have you all here today to ring today's closing bell. I'd now like to introduce you to your executive host for the day, Mr. Joe Brantuck.
Well, good afternoon, everyone. It's truly my great pleasure to welcome Linda Marban, co-founder, president, and chief executive officer of Capricor Therapeutics, to the NASDAQ market site. I'd also like to extend a warm welcome to the members of the management team and all of our distinguished guests. We're excited that you could all join us right here in Times Square, New York, as we get set to ring today's closing bell. Now, first, congratulations on uplisting to NASDAQ from over-the-counter market on March 9th. We are truly pleased to welcome you to our market and for you to join the leading home for healthcare and biotech companies. As a developer of innovative therapies, Capricor Therapeutics has a diversified pipeline of therapeutics which are strategically positioned at the forefront of one of the largest segments of the U.S. healthcare industry, heart disease. Capricor Therapeutics' lead product candidates currently target the prevention and treatment of heart failure and heart attacks, which makes up a substantial portion of the over $200 billion total estimated annual cost of heart disease in the United States. Capricor's lead product, CAP-1002, is being tested to determine if it is safe and effective in impacting heart function and structure, acting by decreasing scar tissue and promoting growth in heart muscle, which may reduce and prevent the development of heart failure. And most recently, in early June, the FDA has cleared its investigational new drug application for the clinical development of CAP-1002 for the treatment of patients with Duchenne muscular dystrophy with significant cardiac dysfunction. Linda, we are truly proud to welcome you to the NASDAQ family. It's great that we have you here and your family with us. And if we could all give everyone a warm welcome to invite Linda up to the podium.
Thank you, Joe. We are so happy to be here today. Capricor Therapeutics is a clinical stage biotechnology company that is developing therapeutics based on the company's platform technologies that aim to address needs such as advanced heart failure, cardiomyopathy associated with Duchenne muscular dystrophy, and other serious diseases. An important step for our company was our listing on the NASDAQ capital market in early March. We could not be more pleased with the results so far, as both the number of institutions owning shares in our company and trading volume of our stock has increased. Capricor is differentiated from most other emerging biotechnology companies in that we have 3 platform technologies from which to derive therapeutic candidates. Our first is CDCs, or CAP-1002, which is an allogeneic, off-the-shelf cell product. A transformative event for Capricor occurred when we saw that CDCs reduce scar and increase living heart muscle in the first clinical trial of its kind called Caduceus. Our clinical development program for the CDCs has evolved to the all-star and dynamic clinical programs in advanced heart disease. However, we are especially excited about our initiation of the HOPE Duchenne trial, which will be a phase 1/2 clinical trial to investigate the safety, tolerability, and potential efficacy of CAP-1002 in patients with Duchenne muscular dystrophy, otherwise known as DMD. As you may know, DMD is an orphan disease caused by mutations in the dystrophin gene that leads to muscle degeneration and ultimately death for the afflicted young men. Since the heart is a muscle too, it too is affected by the breakdown of dystrophin, leading to a cardiomyopathy that has become the leading cause of death in patients with DMD. Since CAP-1002 has been shown to reduce scar size and damage in the heart, we believe it is uniquely suited to treat DMD-associated cardiomyopathy. We also expect that CAP-1002 would complement other dystrophin-correcting therapies. Our second platform therapeutic under development are the exosomes, which originate from our own CDCs. Exosomes are tiny vesicles that are filled with proteins, nucleic acids, and are released from our cells They are used to communicate between cells and are found in everything from milk to beer to urine. The exosomes are most exciting as they are a stable, cell-free, regenerative medicine product that is uniquely suited to battle inflammation and fibrosis in multiple disease areas. While to this point we have focused on cardiovascular diseases, our exosome program will provide us with the opportunity to expand to other indications outside of the heart. Capricor expects to announce a clinical development program and ensuing clinical trials for the exosomes in 2016. Our third therapeutic are a class of natriuretic peptides, which includes sindaritide. Natriuretic peptides can offset multiple disease processes that play a role in negative outcomes associated with heart failure. We recently completed enrollment in a phase 2 clinical trial assessing sindaritide's safety, tolerability, pharmacokinetics, and pharmacodynamics in patients with stable chronic heart failure. We are assessing that data now and expect to announce a clinical development program for sindaritide later this year. As you can tell, there is a lot going on at Capricor. We want to thank the NASDAQ for allowing us to celebrate this exciting time in the history of our company. I also want to take this time to thank our management team in Los Angeles, those that have traveled here to make this possible, and especially I'd like to say thank you to Frank Litvak, our executive chairman. Thank you for your time.
Linda, there certainly is a lot going on. Congratulations
Thank
on
you,
all
Jim.
your success. Truly, and I want to thank you, and on behalf of NASDAQ and everyone that's been negatively affected by heart disease, for your great work. It's a great cause, and we're behind you 1,000%. But I did want to present you with today's closing bell crystal to commemorate today, ringing up today's closing bell, and here you go.
Thank you so much.